here we are in our Christmas sweaters, and we had our morning conference around compassion. And I wanted to start with why patient stories are so valuable to you. Why is it that you want to know the patient's real story?
Well, I think we discussed a little bit in the rounds discussion today, just this idea of, in some ways, we build the story for the patient sometimes prematurely. So we have a patient that is presented to us by, a medical assistant, and we hear their story, and we have our preconceived notions of what the experience is going to be. And yet, oftentimes I found with myself in my own experience, when I go into it with one idea, I usually walk away with a completely different opinion of the experience. So, and it's usually for the better. And so the question is why do I do that? So.
Well, and I think by being able to take in the full history, we're better able to have compassion for their story. The main thing that I try to remember is everyone has a unique story, which we want to hear. We want to know and understand so that we can find out what their goal is at the end of their visit so we can better achieve it.
No, I love that.
We talked also about this idea of connection. Connection, understanding the patient's story leads to a better ability for compassion. How do you find that you're able to connect with your patients?
I might take that one. I think a little bit comes from experience because, believe it or not, I'm an introvert at heart. I don't just go out and talk to people and get to know them. So it takes effort for me. And I think some of it's having had experience working as a nurse on the floor for me, helped me understand if I want my shift to go well, I've got to connect with this patient. I've got to understand their needs early on. Because if I'm trying to learn it at the end of a 12-hour shift, it's going to be a rough shift through that whole course. So for me, it's connecting with a person early on, and it's difficult sometimes because sometimes you don't connect with the patient, but you can definitely try to find commonalities. And it really starts with just letting the patient talk and let them, kind of tell you their story and be engaged in that conversation early on. Because if they can sense that, I think that connection is just organically built in many ways. So
I had kind of a unique experience when I was on the floor as a nurse. We had a patient who, she was dying she had breast cancer, but it had metastasized. And it was very difficult for her to even take in her medications. And she had fired nurse after nurse after nurse. And one day I went in and I was like, what can we do to help make this easier for you? Finding some compassion for her, because I think people were frustrated with her. Like, how can we help her? She doesn't want anyone's help. And we had come to kind of a thought, I was like, where's your favorite place to be? And so she said, Ireland. So I would walk her through a trip to Ireland every time we would give her medications. And I think she felt my compassion, and ultimately we were able to accomplish what she really needed, was just those medications to help decrease her pain. And so having experiences like that where you learn someone and can actually change how they're feeling is both beneficial for them and for ourselves. So it's kind of a cool thing.
And I think a little bit, it kind of goes back and forth, compassion does. I think we as providers should be providing compassionate care to our patients. But I think there is a sense of, patients in the community that we care for, having compassion for the providers. We have limitations. There are certain things that, unfortunately, we can't always do by ourselves. Sometimes it takes, a community. And again, there's some red tape in medicine, unfortunately. We have limitations in that capacity. So I just think if we as a community have compassion one for another, I think ideally we'll see healthcare blossom in the right way. So
have you felt this idea of compassion fatigue, or just, I don't want to do that, or just that feeling of I just can't give anymore, or I don't have that empathy left in me? Have you felt that way before?
I definitely have. I don't feel it now, which is great. When I did family medicine, I think there was a time where it was very short visits. I was taking a lot of my work home, And it was really hard, I think, to give the attention I needed to my patients. And I felt that. That's why ultimately I kind of left that field. Because when you're not able to fully connect with them, it's hard to keep wanting to do it. So,
I mean, we have a really busy practice. We see a lot of patients. We do our best to help each and every single patient, treat them like family. But I'd be lying if I said that there weren't times where, you felt that empathy fatigue. It's your will to want to solve another problem. And I found that one of the strategies that we've done is just being able to have time away from the clinic. Being in the OR provides a different experience. But I just think it's definitely something that can happen to probably most providers, is this empathy fatigue or compassion fatigue. And I think, it's how we come out of that. I think compassion is going to ebb and flow. Your levels varies based on day to day, maybe minute to minute. But the idea is that we're talking about it and that we're thinking about it and doing, retrospective analysis of, what our care looks like day to day. And ultimately, I think that'll help us improve.
I agree.
Good. I appreciate that. The rounds was awesome. It was so good. And the number of people that immediately responded with comments and insightful things to say. A couple things that I thought is that compassion and compassionate care, just like medical care, is delivered by a team. And so I hope that the patients feel a connection, not just to one person necessarily. I mean, they could have a connection to one person, but could feel connected to the whole team of people, because there's a lot more power in the ability of a team to deliver care and compassion than just one person. Mm-hmm. And then I felt that where you are busy and there's not a lot of time, and one of the real limitations that we have is a lack of time. We wish you had more, honestly. And I hope that patients understand the realities of what we're up against with regards to the demand. And last week I mentioned was a call week for me, which is always a busy week. And it was after Thanksgiving. Between Saturday and the following Friday, we did, I think, 32 surgeries. But that was just part of it. There were, at one point, 25 patients in the hospital. And then clinic patients were still being seen. So I had a pile of messages from clinic, which I admit I didn't get to all of them on time. I was delayed 3 or 4 days. But there were 2 specific moments and they were unique moments where I felt like I made a connection. One was a patient that was at another hospital and had a family member that had a large intracerebral hemorrhage. And from my perspective, it was not a survivable hemorrhage. Like, it's so big, the literature all says, yeah, they're not going to make it. So I had told the ER physician, yeah, they don't need surgery, they don't need to transfer, there's no way they're going to survive that. But that was not quite what that family needed. They needed a conversation about it. And so between cases, I was just pacing in the walkway at the hospital and talked to him on the phone for 10 minutes. And it just felt good. And we were able to just discuss why that is not something that you would aggressively treat. And it sort of left me feeling like, okay, it made a little bit of a difference. And just showing that compassion and feeling the empathy there of what they were going through, the difficult decision making. Is this really what we want to do? Do we really want to withdraw life support and those kinds of things? The other one was last night. I was determined to get all of the messages done, and so it was a bit of a grind to get through 30 messages in one evening setting, with trying to respond to little baby girl's needs and everything else at home. And one of the patients had a spinal cord stimulator trial for a chronic pain situation, and pretty routine thing for us, right? We do that all the time.
Yeah.
So a pain doctor somewhere does a spinal cord stimulator trial, and they send them to us to put the implant in. So we're basically just a technician. Like, they just want somebody that can just put it in safely, effectively, and not get an infection. And then, but I just was like, I'm going to call that guy. And I was the only patient I called. Maybe there was one other. Well, maybe two others. But I called him, and it was a delightful conversation. He had been through a big tumor resection that saved his life but left him with pretty debilitating pain, and the stimulator trial had given him 99.9% relief. And then it was so disappointing when they took it out, and he just was praying and hoping that he could get it done as soon as possible. And I'm just like, we're going to get this done. But that's where medicine becomes so fulfilling, is when there is a level of understanding. We know the story. We know the situation. We're here to help. We're working together. There's feeling involved. And it's hard because there's burnout, and it's a grind, and there's red tape and all these other things that sort of get in the way. But I love the rounds this morning. It was fantastic.
Yeah,
just this idea of we're here because we care.
I love that. And I think one statement that's always resonated with me is, patients won't always remember everything that you said, but they will remember how they felt.
Mm-hmm.
And I think that's something that we can all reflect on in our interactions with our patients day to day. So.
Yeah. Love that.
So pardon our enthusiasm, but we love what we do, and we're excited to be able to hear our patients' stories, connect with them, and try to exercise compassion, understanding, and help in any way we can.
Love it.
Love it.
Okay, thanks.